Now it's time for 3x3 Experiment by JCD, comparing stories from ABC, CBS, and NBC. The never-ending 3x3.
An appeals court judge keeping New York's indoor mask mandate for schools and businesses in place, at least for now. There was a lot of confusion these last 24 hours after another judge tried to halt the masks. There will now be a hearing, and it mirrors the debate across this country. And all of it comes as the U.S. is still reporting 664,000 new cases a day. Hospitalizations climbing in 13 states, nearly 20,000 COVID patients admitted to hospitals every day across this nation. And we are still seeing about 2,000 COVID deaths every day.
Well, turning now to COVID, Pfizer has announced the start of clinical trials for a new vaccine that will specifically target the Omicron variant. And it couldn't come soon enough, as the 7-day average for COVID deaths near 2,200 a day. That's the highest it's been in nearly a year.
Good evening. In the constant chase to get ahead of COVID-19, a new Omicron-specific vaccine is about to enter testing. But in a measure of just how quickly this pandemic is evolving, the question being asked, will we need it by the time it's ready? The modified vaccine by Pfizer perhaps months away as new COVID cases continue to drop, still leaving overwhelmed hospitals.
Announcing the start of their new clinical trial today, Pfizer says it's testing if their new reformulated COVID vaccine will specifically target the Omicron variant and to see how effective that new formula would be. With Omicron still fueling a pandemic record of ER visits, today the CDC confirmed the disease severity appears to be lower than previous peaks, but medical centers remain overwhelmed with the sheer volume of those sick. And now the FDA says 2 monoclonal antibodies by Regeneron and Eli Lilly can no longer be used after proving to be ineffective against Omicron, which accounts for 99.9% of infections.
CBS's Chris Van Cleve is in hard-hit Oklahoma City.
Tonight, a new look inside an Oklahoma City ER overflowing with COVID patients. Dozens are waiting for ICU beds, but every single one at 4 of the state's largest hospitals is full.
Which are now finding some antibody treatments against Omicron are not working. So today, the Biden administration is pulling its rule that employees at large companies either be vaccinated or regularly tested. As now 2 years into the pandemic, mask rules continue to generate heat. Miguel Almaguer starts our coverage.
Tonight, that late word from an appeals court judge keeping New York State's school mask mandate in place for now. It comes just hours after a ruling striking down the state's indoor mask mandate sparked chaos and confusion across schools and businesses.
We're not anti-mask. We're anti-mandate.
After the Supreme Court shot down President Biden's mandate for large businesses to require workers be vaccinated, the Biden administration now officially withdrawing the business mandate today. The White House has said many large businesses have already put in place rules of their own.
The situation is so dire, it prompted this warning. The Oklahoma City healthcare system is at a breaking point.
It feels like a war zone when there are fires everywhere, and it's a battle trying to take care of the wounded, trying not to get wounded yourself.
The governor had vowed to fight it, even with COVID cases dropping dramatically in New York.
The last thing I want to see is a different trend because people gave up on the mask.
I think it's common sense. I think it's safe to have a mask.
Some schools today swiftly ditching the mask rule, others keeping the mandate in place, outraging some parents.
That is a lie. You guys will all be sued. Watch me.
The CDC says new data confirms Omicron causes less severe disease than previous strains of the coronavirus. But it is so infectious, it's causing hospitalizations and deaths to rise, something Oklahoma is seeing right now.
For one day, give these kids the opportunity to have the choice to be maskless or masked. It's their constitutional right.
Do you feel like you'd be in a better situation if the vaccination rate in Oklahoma was higher?
There is no question in my mind. Our ICU physician and I were talking yesterday. He's seeing still mortality rates of up to 50% in ICU patients who are unvaccinated. Up to 50%.
Right. It comes as the country reports 664,000 new cases a day, and hospitalizations are still climbing across 13 states.
Dr. Julie Watson is the chief medical officer at Integris Health. Monday, its hospitals set a new record for COVID patients as the state's vaccination rate lingers at less than 55%.
Southern Idaho once again activating its crisis standards of care.
I know that everyone is tired of the pandemic. Like you, I wish that we could be done with the pandemic. But unfortunately, the pandemic is not done with us.
Is this as bad as it's ever been for your hospitals?
I would say yes. This is our fourth wave, and it's demoralizing to not be able to do your job the way that you were trained to do when our job is to save people's lives.
And tonight, Dr. Anthony Fauci calling Pfizer's move to test an Omicron target vaccine a prudent move.
Police officer Brandon Owens has been in the ICU and on a ventilator for more than 2 weeks.
He spent 14 years in the military. He did 3 deployments overseas. We'd never expected this to be something that would get him down.
Many of the people we've spoken with here in Oklahoma have refused to answer any questions about vaccination status. And tonight, we're learning that scientists around the world are closely watching a subvariant of Omicron that's been found here in the U.S., but they don't know yet just how dangerous it may be. Nora?
So demoralizing for those healthcare workers.
When asked about the back-to-back nature of the COVID variant surges, Dr. Fauci saying he does not believe we will be seeing that kind of pattern indefinitely.
Even if new variants emerge, they don't take that surge effect that we've seen with the 4, now 5 surges that we've seen since the early 2020. So I don't believe we're going to be seeing that indefinitely. I think it's going to come down and down. And quite frankly, the more people that we get vaccinated and the more people we get boosted, the less the likelihood that we'll be seeing these return of variants that keep challenging us.
Nearly 2 weeks after the Supreme Court knocked down President Biden's vaccine mandate for large companies, the Labor Department today officially withdrawing those vaccination and testing requirements. Though the Biden administration says 98% of federal workers are already vaccinated under a mandate. And tonight, one man in Boston is reportedly facing dire consequences for not getting the vaccine. The family of DJ Ferguson says the 31-year-old father desperately needs a heart transplant, but is not eligible because he has not gotten the shot. The hospital saying, like other transplant programs in the United States, the COVID vaccine is one of several vaccines and lifestyle behaviors required for transplant candidates in the Mass General Brigham system in order to create both the best chance for a successful operation and also the patient's survival after transplantation.
Tonight, a nation exhausted of COVID, still paying the pandemic's price.
Miguel, circling back to the Biden administration, why are they reversing course on the vaccine or test mandate for large employers?
Well, Lester, the change followed the Supreme Court's decision to block the rule earlier this month. Many large businesses, including Starbucks, for example, also dropped their vaccine mandate after the Supreme Court decision. Meanwhile, the debate over masks in several states continues to play out in courtrooms across the country. Lester.
Ethicist Dr. Arthur Kaplan says this is not about discrimination, but about your vaccination status predicting the likelihood of the transplant's success.
A cold could kill you. COVID could kill you. The organs are scarce. We're not going to distribute them to someone who has a very poor chance of living when others who are vaccinated have a much better chance post-surgery of surviving.
The masks back for now in New York, but there's a hearing coming.
That's right, David. It's now up to the appellate court to decide whether or not the mask mandate here in New York can stand. Previous judges have sided with the state, and Governor Hochul says she plans to lift the mask mandate if cases continue to drop next month. David.
Ariel Reshef tonight leading us off. Ariel, thank you.
With the vaccinated and boosted already highly protected against hospitalization, the FDA would then have to consider if the formula is even needed. In a trial expected to take months, it comes as pockets of the nation emerge beyond Omicron's peak.
How difficult is it to get ahead of a new variant with a vaccine?
If a new variant emerges, we can always build vaccines, but they can take several months to build and test. Vaccines always play a really important role, but often not fast enough to deal with a new variant. Where the virus changes, we have to change our tools. Some of the old tools will work. Sometimes you have to build new ones.
As new infections this month alone total nearly half as many cases as all of last year, the virus is still evolving faster than our tools against it.
I don't think there's a chance that we're going to eradicate this. We've only done that with one virus, and that's been smallpox.
Miguel Almaguer starting us off. Thank you.
How much of it is COVID? COVID's brought a light to an issue that was already here.
Let the human talk.